All right, let's talk more about this. Dr. Jaspal Singh is the Director of Interventional Spine at the Department of Rehabilitation Medicine at Weill Cornell Medicine, and he joins us now live from New York. Welcome to the News Hour. I've been really looking forward to speaking to you. Tell us, what has a year of working from home done to our bodies? What are your patients telling you?
Yeah, good morning. What we typically see at our spine center is patients reporting lower back pain. These were laborers or people who are out on the job getting injuries due to working. Now what we've seen for almost a year since this pandemic first started is a lot of upper back and neck pain causing headaches. And the reason for that are things that you mentioned. We have these makeshift workstations at home. Patients are using laptops on their bed or on a coffee table, on their sofa, and it's just not properly set up for their spine. They're hunched over, shoulders are going forward, they're using a keyboard at the wrong height, a monitor at the wrong height, and we're seeing a lot of upper back and neck pain as a result of working from home. And
not everybody can have that wonderful makeshift office at home like we see sometimes on social media. And their only option might be the kitchen table with a kitchen chair, the sofa, even your bed. So what can they do so that they don't have to come to people like you, doctors like you, with complaints?
Right, so there are some quick strategies that you can make at home to try to prevent some of these injuries. And if you have these pains, making these modifications can eliminate and reduce that discomfort. So one of the quickest things is to bring the monitor up to a reasonable height. What we've seen at the kitchen table or even in bed is patients are flexing their neck. And if you can use pillows or books and elevate the monitor to a height where your eyesight is more level, you're going to avoid a lot of the stress on your shoulders. The other big thing we see is in relation to the chair. If you're sitting on the couch or you're slumping or slouching, it puts a lot of stress on your lower back, a lot of stress on your hips and knees. So one quick thing to think about is keeping your hips at 90 degrees, keeping your knees at 90 degrees, and bringing the floor up to your feet so they're level. So these kind of quick things can just help reduce the repetitive strain type of things that you discussed earlier.
And doctor, there are other people like myself, like my colleagues. We're not working from home. We're working as usual in the studio. And I do admit, I think my body has changed. My posture has changed. Why is that? Is that the effect of, I don't know, the worry of the pandemic? Are you hearing about that from people that are not necessarily, working from home? Is the worry of the pandemic just, I don't know, is there such thing as a pandemic posture now because of that worry? I guess that's my question.
No, that's a great point. Not only has working from home caused these direct physical manifestations of pain, but overall well-being. We know that with the quarantine and social distancing and self-isolation, which were critical to preventing the spread, we also know that patients have been exercising less. And we know exercise can boost your immunity. Exercise is good at reducing stress and anxiety. Exercise is good at getting good quality sleep. So when we take exercise out of the equation, we're seeing a lot of patients with increased stress and anxiety. And most of us keep this stress up in our shoulders because we're shrugging, we're really, really tense. So just finding a way to be a little more mindful, getting out and walking, taking breaks while you're working from home. We say try to take 60 to 90-second breaks many, many times throughout the day. Stand up, walk around, decompress your spine. These kind of simple strategies are going to reduce a lot of the indirect manifestations of the pandemic.
You're absolutely right, and so helpful. Thank you so much. I'm going to really make sure I don't keep my stress in my shoulders. Dr. Jaspal Singh, fantastic to speak to you.